my name is Alexis. I'm your student nurse today. How are you feeling today?
Good.
Hi, Jean. Good. Do you have any pain today?
No.
Today I'm going to be doing a head-to-toe assessment on you. Have you had one done before?
Yes.
Okay, good. Before I begin with your head-to-toe assessment, I'm going to be asking you some questions, okay? But before, can I go ahead and borrow your wrist? And can you go ahead and identify your name?
Elsa Martinez.
And your date of birth?
02/12/92.
Okay, perfect. Okay, so what's today's date?
August 26, 2020.
Yes, and who's the president?
Donald Trump
And where are we right now?
in a clinic.
Okay, so my patient is alert oriented times 3 to person, place, and situation, and vitals are normal. Before I begin, I'm going to ask you some questions. Just try to answer to the best of your knowledge, okay?
Okay.
Do you have any health problems, diabetes, high cholesterol, hypertension, anything like that?
No.
Any cancer before?
No.
Have you had any surgeries?
No.
Do you have any allergies to food, seasonal allergies, drugs?
No.
No. So right now you say you have no pain. From a 0 to 10, what would you go ahead and rate that?
0.
0? Okay, so you say you hadn't head to toe done before. Okay, so do you drink a lot of caffeine?
No.
What's your physical activity? Moderate, a lot, not work out a lot? Do you walk?
None.
None? Okay, so do you have a pacemaker?
No.
Do you have asthma?
No.
Okay, so I'm gonna go ahead and begin with head to assessment. At any point you need to go ahead and stop, just go ahead and let me know and we'll go ahead and stop there. Okay, so first I'm gonna go ahead and start right here. I'm gonna just put my hands on there and just make sure everything's symmetrical and good. Okay, everything's good, everything's round and perfect. Okay, so now I'm gonna go ahead and start. I'm gonna assess your eyes, but before, do you wear any contacts?
No.
Have you had any LASIK surgery?
No.
Do you have any dryness in your eyes?
No.
Okay, so what I'm gonna do is I want you to keep looking at me. I'm gonna shine this light at you and just stare at me. Okay. 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 Okay, perfect. Now what I want you to do is I want you to look at my pen and just follow with your eyes, okay? Do you feel okay?
Mm-hmm.
Okay, now what I want you to do is keep looking at it and follow it. And come out. Now keep looking at it. Now look at me. Now go back to it. Okay, perfect. At this point, I would have had her done this Nellens chart just to make sure to see her, check on her vision. Okay, so now what I'm going to go ahead and do, I'm going to go ahead and just look at your sclera, make sure it's good. Okay, perfect. Now I'm going to go ahead and check your ears. Do you have any hearing aids? Do you have problems hearing?
No.
No, okay, I'm just gonna go ahead and check that. Okay, good. Okay, perfect. I'm gonna go ahead and whisper something in your ear and just tell me what I say, okay?
Pizza.
Okay.
Pizza.
Okay, perfect. So we're good on that part. Now what we're gonna go ahead and do is we're gonna go ahead and I'm gonna ask you to remove your mask for me, please. Okay, so I'm gonna go ahead and I'm gonna check the patency in your nose, and you say you don't have problems breathing or anything like that.
No.
Okay, I'm just gonna make sure I wanna see if it's symmetrical. I'm pushing my finger on here. Go ahead and blow. Go ahead and blow. Okay, perfect. I'm gonna go ahead and check, make sure everything is nice in there. Okay, perfect. So now what I'm gonna go ahead and do is I'm gonna go ahead and I want you to close your eyes for me. I'm gonna put something in your nose and let me know what it is you smell.
Vicks.
Okay, perfect. Now what I'm gonna go ahead and do, keep your eyes closed. And I'm gonna, do you feel that?
Yes.
Do you feel that?
Yes.
That?
Yes.
That?
Yes.
That?
Yes.
Okay, perfect. Now what I'm gonna go ahead and do is I'm gonna go ahead and check your mouth. Do you get any sores? You don't have any, have you had any surgery in your mouth?
No.
Do you have your tonsils?
Yes.
Okay, so what I'm gonna go ahead and do is I'm just gonna go ahead and have you say ah. Okay, I'm gonna make sure everything is nice and moist and pink. Okay, now I'm gonna go ahead and check her gag reflex. Okay, so that is good. You have your back reflex. Okay, now what I'm gonna go ahead and do is, can you go ahead and wink for me? Can you go ahead and smile for me? Blow a bubble. Stick out your tongue. Frown. Okay, now I'm gonna go ahead and, what am I gonna, oh yeah. Now can you go ahead and follow what I do? Can you go ahead and pick up your head? Center. Down. Center. Turn. Center. Turn. Center. Now just rotate. How do you feel? Do you feel okay?
Mm-hmm.
Okay, now I'm gonna go ahead and just slowly, I'm gonna check on here. Okay. I'm gonna check your sinus. Do you have any sinus problems? No? Okay, I'm gonna go ahead and check her carotid artery while I'm here. Never doing it at the same time. I'm gonna go ahead and check her temporal. Okay, perfect. Now what I'm gonna go ahead and have you do is I want you to go ahead and I want you to grab my fingers and squeeze as hard as you can. Okay, let go. Now I'm gonna go ahead and have you put your hands out. What I want you to do is I want you to pull up while I push down. Okay, now the other side. Pull up. Okay, now on the side, I want you to pull outward. Okay, now I want you to put inward. Okay, now that I am here, I'm gonna go ahead and just check your reflexes. Are you feeling okay?
Mm-hmm.
Okay, so I'm gonna go ahead and check this reflex first. Okay, now I'm gonna go ahead. Okay, now we'll go ahead and check in the back. Okay, now I'm gonna go ahead and check her patellar reflex. Okay, now I'm gonna go ahead and check this reflex. You can see it. Okay, now I'm gonna go ahead, on your reflexes, you're good. Now I'm gonna go ahead and just check your other pulses while I'm here. I'm gonna check them bilaterally. Okay, I will check, I'm checking the back. Okay. Okay. Okay, pulses are normal and feeling the same bilaterally. So now what I'm gonna go ahead and have you do, are you feeling okay?
Yes.
Okay, now I'm gonna go ahead and have you stand up for me. Oh yeah, can you put your mask on?
Yes, ma'am.
Okay, so I'm gonna go ahead and check your stride and how the way you walk for any swerving or anything like that. So I'm gonna go ahead and have you just, can you just walk in a straight line and come back for me? So at this point, I'm checking her gait, make sure she's walking normal and balanced. Okay, perfect. Now what I'm gonna go ahead and do is I'm gonna do the romper stand. I'm gonna be checking your balance. So I'm gonna have you close your eyes and put your arms out. Okay, go ahead and relax. At this point, she is good on her balance because if not, she would have been moving. Now we're gonna go ahead and check your range of motion. Before I do that, have you had any joint problems? Any
No.
dislocations?
No.
Any surgeries?
No.
Okay. So what I want you to do is I want you to go ahead and come up. Follow me. Center, down, forward, down, back. Okay, now your foot. And then the other way. Okay, now I want you to just move your ankle, your other ankle, your wrist, open, close, circles, open, your fingers. Okay, perfect. So you're feeling okay, right?
Yes.
Okay, while you're here, what I want you to do is I want you to turn around for me and touch your toes. I'm gonna go ahead and just run my finger down her spine just to see if there's any kind of scoliosis or anything like that. Okay, you can go ahead and come back up. Do you feel okay?
Yes.
Okay, so now what I'm gonna go ahead and do is have you sit down. And I'm gonna go ahead and just, I want you to lift for me. That way I'm gonna check for any neck pain, any distension. Okay, now you can turn around and everything looks good. Okay, so what I'm gonna go ahead and do is I'm gonna have you stand up one more time. I'm gonna be checking your heart. Do you worry, no pacemakers or anything like that, right?
No.
No open heart surgeries?
No.
Okay. So I'm gonna go ahead and just be listening to your heart, okay?
Okay.
Okay. So now what I'm gonna go ahead and do I'm gonna start in her left side, her right side, sorry. So I'm gonna start in the pulmonic. Then I'm gonna go into the aortic. Then I'm gonna go into the Erb's point. Then I'm gonna go ahead and go into the tricuspid. And now I'm gonna go ahead and lift her, move with the back of my hand and listen to the apical pulse, which is on the 5th clavicle, for 1 whole minute. Okay, everything sounds good. So now what I'm gonna go ahead and do is I'm gonna go ahead and listen to your lung sounds. Do you have any problems breathing? Shortness of breath?
No.
Chest tightness?
No.
Nothing like that?
No.
Okay, so I'm just gonna be having you breathe in and breathe out, and at any moment you feel dizzy or anything like that, just go ahead and notify me, okay?
Yeah.
Okay, breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe in. Okay, I'm gonna lift your arm for me. So I'm gonna check the lobes on this side. Breathe in. Breathe out. Alright, go ahead and relax. And on this side. Breathe in. Breathe out. Okay, now I'm gonna go ahead and have you turn around. Are you feeling okay?
Yes.
So I'm gonna go ahead and check the back. I'm gonna ask you again to breathe in and breathe out for me, okay?
Mm-hmm.
Breathe in. Breathe out. Breathe in. Breathe out. Go ahead and open your arms. Make sure I don't want to touch her. I don't want to put on her bone. Okay, go ahead and relax. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe in. Breathe in. One more time. Breathe in. Okay, feeling okay?
Mm-hmm.
Okay, now what I'm gonna go ahead and do is I'm gonna say 99 and I want you to just repeat after me, okay?
Yes.
Say 99.
99.
99.
99.
Okay, perfect. Now I'm gonna go ahead and have you turn around. Now I'm gonna go ahead and I'm gonna ask you to. I will be assessing her skin at any time. Make sure there's no pressure ulcers on her bony prominences. Make sure there's no wounds, any lesion, anything like that. I'm gonna go ahead and ask you, can you breathe in? I'm gonna go ahead and check her chest. Make sure she's not using any other muscle, or say there's no barrel chest or anything like that. Okay. Okay, now I'm gonna go ahead and check her thyroid. So now I'm gonna go ahead and just feel it, make sure it's normal. Okay, go ahead and swallow for me. Okay, perfect. Now you're gonna go ahead and take a seat. And I also was checking for that there was no deviation in her trachea or anything like that, and she was able to swallow and everything was good. So now I'm gonna go ahead and have her lay down for me. Before I begin, do you have any pain in your abdomen?
No.
Do you ever feel it like bloated or anything like that?
No.
No? Okay. So now what I'm gonna go ahead and do is I'm gonna go ahead and inspect her abdomen. Make sure there's no stomas, make sure there's no masses or any abnormalities. So I have inspected, so now I'm gonna go ahead and just, I'm gonna go ahead and osculate all her 4 quadrants. I would listen for 1 minute, and if for five vowel sounds, and if there's no sound, I would stay there for 5 minutes. Okay. Now what I'm gonna go ahead and do is I'm gonna go ahead and slightly palpate, make sure that I don't feel any masses on there. I would go ahead and check her right lower quadrant, make sure on the McBurney's point, make sure if I would slowly palpate, if there's a reaction to it, it might be a problem with her appendix. So I'll just go ahead and slowly palpate. Okay, I don't feel anything, so now I'm gonna go ahead and slowly just start percussing. Okay, perfect. So she's good there. Now I'm gonna go ahead and move to the bottom part. Before I begin with this, do you need to go to the restroom?
No.
No. Okay, I'm gonna go ahead and just ask you some questions. Just go ahead and try to be honest as possible. Do you have any pregnancies?
No.
No. Okay. How about your period? Is it normal every 20 days or
Yes.
abnormal?
It's normal every 20
Okay.
days.
Do you have you noticed any pain during urination?
No.
Any foul odor? Any discharge of foul odor?
No.
Or any just abnormal discharge?
No.
No? Okay, so at this point, I would make my patient as comfortable as possible. I would go ahead and have her covered and just uncover the private area, put her in lithotomy position. I would go ahead and open the major labia and the minor labia just to inspect, and the rectum area for hemorrhoids or anything abnormal. If it was a male, I would go ahead and pull back the foreskin, make sure it's clean, make sure there's no discharge. I would go ahead and ask them about their urination pattern, make sure it's not cutting, because that could be a problem with the prostate. And I would also inspect and make sure there's no warts or anything like that. Okay, so now that my patient is good, now I'm gonna go ahead and check her legs. So she's done with that. So at this point, I will be checking for any clots, make sure there's no pitting on her legs. Do you have any pain on your legs or anything like that? No? Okay. So again, I checked the pity, I did everything. I would also go ahead and check my patient's feet, make sure that there is no pressure ulcer on the heel. If they're diabetic, I would make sure and check their toes, in between their toes, make sure everything's good and healthy, so it's good. I'm gonna go ahead and check. Can I have you just remove your glove for me, please? I'm gonna go ahead and just check her capillary refill, make sure it's less than 3 seconds, everything's good. Okay, perfect. So now I'm gonna have you sit up. Okay, so now I am done with your head to toe assessment. My patient, again, I was checking on her the whole time, making sure there was no change in her mood or anything like that. Vitals were good. She was alert and oriented. Level of consciousness, everything. So now I am done, and you are pretty healthy. So do you have any questions for me?
No.
Before we leave? No? Okay, so I'm gonna leave your hair so you could get dressed and ready to go, and thank you very much.